Hi everyone, a warm good afternoon to each and everyone. See, reduce your volume or keep your earphone. If you have earphone, it will be. I can hear, no? Hello, hello. Hello. We can. They can go there, no? You go to your places. You go to the. आप अपने cabin में चले जाना. No problem, आप ही चले जाना. Hey, you'll be here because you have no cabin, no? Then you go to Amit cabin. So this sound will come. They are near. But when I speak, I need to increase the volume. No, no, you don't want to increase the volume. Then if I speak, you can hear. There is speaker, not mic. Otherwise, it will be very sounding. It will be disturbing for me. Okay. You will accept everyone of us. Yeah. After. Good afternoon, everyone, on this wonderful day. It's February 4th, 2022. You know what is the specialty of this day? It's the World Cancer Day. So it's very important that to speak about this Cancer Day. That is, on 2022, we are making this World Cancer Day as realizing the problem. What is the actual problem in reaching out the gap between the care what we give to the cancer patient? So the theme for this 2022 World Cancer Day is close the care gap. So this is the campaign is going all over the world, which is all about understanding and recognizing the inequities in cancer care around the globe. It's about having an open mind, challenging assumptions, and looking at the hard facts. So, what are they looking at? The hard facts are inequity in cancer care cost lives. People who seek cancer care hit barriers at every turn: income, education, location, and the discrimination based on ethnicity, gender, sexual orientation, age, disability, and lifestyle are just a few of the factors that can negatively affect the care. The gap affects everyone, including you and your loved ones. So these barriers are not set in stone, they can be changed. So this is the year to question the status and help reduce the stigma, to listen to the perspectives of the people living with cancer and their communities, and let those lived experiences guide our thoughts and actions. That's how we can begin to imagine a better way of doing things and to build a fairer vision of the future. A future where people live healthier lives and have better access to health and cancer services, no matter where they are born, grow, age, work, or live. To make this day a grand in a great manner, we, the Department of Medical Surgical Nursing, Pannadama Subhadi Nursing College, we have organized different activities like students are doing health education and other sides of activities. They spread the information as awareness to the patients and the relatives and for the communities in the hospitals and various community settings, where the faculties or department are joined together to have a panel discussion on the theme what we have discussed, what I have mentioned you earlier, close the care gap. So at this moment, I would like to welcome all the speakers, all the panelists of this day. So just an introduction about them. Here we have Professor Hepsinada, the HOD of our department, Mr. Amir Khan, Assistant Professor, Mr. Suraj, Assistant Lecturer, Mr.
As a
Lakshmikant,
lecturer,
and Mr. Amit Kumar, Assistant Lecturer. So these are the panelists. They are going to share their thoughts about different themes, different sub themes. So I am moderator, Professor Anand Samparera here. The to introduce each and everybody. So as I said, close the care gap. Here comes the HOD and Professor Epsinada to elaborate on the theme of the World Cancer 2022. Ma'am, it's
your
your.
time.
Thank you, Professor Anand. I take this privilege being a panelist in this panel discussion to talk about the theme. This is a wonderful theme that has been given this year, that is close the care gap. It means closing the gap in cancer care. Here, I would like to discuss what is the theme, the importance of theme. So, half the world's population lacks access to the full range of essential healthcare services. So, when it comes to cancer, many of us are denied basic care, despite the fact that we live in a time of awe-inspiring advancements in cancer prevention, diagnosis, and treatment. So, this is the equity gap and it's costing lives. So, people who seek cancer care hit barriers at every turn: income, education, geographical location, and discrimination, which is based on the ethnicity, race, gender, sexual orientation, age, disability, and lifestyles are just a few of the factors that can negatively affect the care. So the most disadvantaged groups are also more likely to have increased exposure to a host of other risk factors like tobacco, unhealthy diet, or environmental hazards. So the gap affects everyone. So you might feel like the equity gap doesn't impact you personally, but I think it likely does affect someone you know. While it's more pronounced in low and middle income countries, well resourced countries show dramatic disparities too. It's almost guaranteed that the gap affects your people in your community, so we can close the gap. So the reality today is that who you are and where you live could mean the difference between life and death. It isn't fair, but we can change this. What do you mean by inequity? As the term says, inequity. So in healthcare systems, inequity refers to the uneven distribution of resources. By contrast, inequity means unjust, avoidable differences in care or outcomes. So the difference may seem subtle, but closing the cancer care gap isn't really about simply providing everyone with some equal resources. One size doesn't fill at all, and every challenge demands a different solution. So equity is about giving everyone what they need to bring them up to the same level. So it is not about me and you, it's about everyone. So the equity gap is a reality for all countries everywhere, high and low income alike, and negatively affects people from all walks of life. If you see in US, like for white women, the 5 year survival rate for cervical cancer is around 71%. For black women, the rate is just only 58%. And if we talk about childhood cancer, the survival rate are over 80% in high income countries, but as low as 20% in low income countries. So more than 90% of cervical cancer in women, the mortality occurs in mostly low and middle income countries. So every year cancer kills 10 million people and some 70% of those are aged over 65 or older. It's older populations face disappropriate barriers to effective treatments. So there are some notable differences in cancer related outcomes for rural and non-rural patients even in high income settings such as United States of America. So now I wanted to just say, what does an equitable world look like? If you talk about the world, so we will achieve health equity when every person has the opportunity to reach his or her full health potential without barriers or limitations which is created by social positions or other socially determined circumstances. So inside the gap equity, I could say there are 7 barriers that could observe which stands in the way of cancer care. Where you live, who you are, where you come from and what you do, who you love. These are called the social determinants of health and they represent the many factors that can unfairly stand between you and cancer prevention, diagnosis and treatment. So, what are these 7 barriers that we have to keep in mind so that we can fill the gap, care gap? So, first one is gender norms and discrimination. If you talk about the world, that is around the world, women and girls suffer a lot from this discrimination, as we all know, as a result of misogyny, stereotypes, and expected gender roles. And even certain cultural and religious contexts may further limit the access to timely cancer care. Even men also face many negative effects of gender discrimination and societal and cultural taboos too. And the second barrier is barriers for minority population. Here comes the racism. Racism has a profound effect on person's ability to access cancer care and minority population. Even often face serious barriers in accessing the
Why you didn't say yes? No, no, just no. No, ma'am has to unmute. Ah, now you are unmuted. No, you have to start from first again.
then I will start from second barrier.
Second variant. Ma'am, I will operate through mobile sir. Because we are having an exam. 2 o'clock. I'm taking care. I will operate through mobile sir. So,
So should I start?
wait 1 minute. I'll tell you. No?
You can able to say because
From here I'm saying. No, I will. No issues. We can anyhow.
so should I say?
From the third barrier. Ma'am, 1 minute. I'll tell you. I'll tell you.
You say to start and I start.
Yeah, yeah, yeah. Yeah, yeah, yeah. I'm unmissing. Move, 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 move. Move, यार. Yeah. तो वेस्ट कर रहा. Ma'am, you can proceed.
So now we will see about the third barrier, that is poverty and socioeconomic status. So poverty seriously limits the access to quality cancer care. In high and lower income countries alike, the lower socioeconomic status means less access. Countless obstacles Countless obstacles tied to one's financial means include transport to hospital from remote locations, inability to take time off work or find childcare to accommodate screening or treatment, and a lack of health insurance or other financial means to manage the high monetary cost of care. That is one barrier, and the other barrier is the rural urban divide. So, people who are living in rural areas face many obstacles standing between them and their chances of surviving cancer. A lack of prevention, screening, and even treatment services likely means traveling along distances to access the necessary resources. The financial burden of this travel alongside the need to secure childcare and time off work can be insurmountable, and that is one barrier. And the next fifth barrier is age discrimination. Even this plays a vital role for getting the gap in providing cancer care. So how old you are shouldn't decide the quality of cancer care you receive, yet this is the reality of many. So cancer can develop at any age, but the risk of that happening rises dramatically with age. In fact, more than half of the people who have cancer are 65 years or older than that, because early cancer symptoms can be mistaken for everyday pain or minor illnesses associated with older age. And next, let me talk, as we're talking about the age discrimination, cancer and aging. There were many studies which highlights how older populations are denied equitable cancer care. A high proportion of older women with a particular form of breast cancer receive less chemotherapy than their younger counterparts, despite evidence of the treatment's efficacy. And more than 70% of the death rate caused by the prostate cancer among men who are aged over 75 years, who usually have more aggressive disease. And fewer older patients, however, receive treatment for localized prostate cancer, and in most of the cases, they are denied access to chemotherapy for advanced diseases. And next barrier is refugee status and forced displacement. So, in countries who are facing many problems with the political, financial, and social instability, like from war, social upheaval, or natural disasters, cancer organizations are there where they have to deal with harrowing shortages of resources or even a complete breakdown in basic healthcare services. And next is homophobia, transphobia, and related discrimination, which is the last barrier for providing which causes the care gap for providing care to the cancer patients around the world. They were like lesbians, gays, bisexuals, transgenders, queer, and intersex. These people face hostility and discrimination by the people and which who are around them, and they are also more likely to face ignorance or outright prejudice from health practitioners. Furthermore, fear of poor treatment by the medical establishments understandably drives many people away from timely and effective cancer care. Such discrimination takes an insidious toll and can lead to behaviors known to increase cancer risk, such as drinking, smoking, or illicit drugs use, as people seek ways to self medicate themselves and cope with a world that is far too often hostile to one's very existence. So, here there is a goal. These are the main seven barriers, mostly we look into it, and then we have a goal. The goal is very simple: health equity now. That is the goal. So the cancer gap is not inevitable. Our systems can be reimagined, a person's situation can be improved, the knowledge about cancer can be increased, and their access to services made very easier. And collectively, we can reduce inequity. How we can collectively reduce the equity inequity by educating the public about cancer prevention. This is the main role of us, everyone of us in the society, equipping all the healthcare professionals with skills and knowledge, including about how inequity influences cancer care, strengthening primary healthcare delivered in communities, addressing through policy and programs some of the social and economic factors that can negatively affect people's health, increasing the resources, meaning both money and people dedicated to cancer research, and tracking the burden of cancer nationally to more effectively shape our investments. And last is implementing country specific care prevention and control plans which addresses each country's unique needs and resources. So as individuals, we have an important role to play in this society. How? What is the how we have to improve the role? How? So by raising our voices and pressure governments to address the most root causes of these inequities and to treat cancer as an important health issue, and by challenging directly, vocally, and unwaveringly stigma and discrimination in all its forms. So with this, I would just say that we can, everyone in the society should come forward and can fill this gap in filling the gap for providing the cancer care in all the ways. Thank you so much.
Thank you so much, ma'am, for the great elaboration on the theme that what you shared about the equitable world, which looks like, and how the care can be shared to everybody, how we can reduce the gap in providing care for the oncology patients. And also you have clearly explained about the 7 barriers that should be stopped so that we can have the care in a proper way. Thank you so much, ma'am, for your thoughts on this theme. Thank you so much, ma'am.
Thank you so much.
Next, so just now we saw about the theme. So how this theme, as we said, reduce the gap, how we can spread this awareness towards the community. So in order to speak about that, in order to reduce the gap in the community area, here comes Assistant Professor Mr. Amir Khan to speak about the community gap to reduce the care gap for the oncology patient. So Mr. Amir Khan, Mr. Amir Khan, Mr. Amir Khan, Mr. Amir Khan, can you hear me? It's time for you. You can take 3 minutes for this. Okay, Amir Khan. Okay. Unmute your mic. Unmute your mic. Unmute the mic. Unmute your mic. Okay.
Good afternoon, sir.
Yeah, good afternoon.
Audible?
Yeah, audible. You can present.
Good afternoon, sir, and good afternoon for all MSN department, Panna Dayama Swarthi Nursing College. Thanks, my ma'am, principal ma'am, and HOD who gave me this opportunity in front of you Today we all are discuss World Cancer Day 2022. Filling gap of the community. How you can filling gap for community World Cancer. Filling gap assessing the firstly community. Second, cancer community work as a local area with clinician, patients and managers to deliver the national cancer strategy to improve performance of cancer services and to facilitate communication and engagement around cancer issue. All of us have knowledge what is cancer, causes of cancer, signs symptoms of cancer, and investigations what you can do. First, investigation is the backbone of the treatment, and what is the management of cancer. If you have knowledge regarding cancer, you can awareness to the community. Cancer community receive both central government funding and local health bodies. Next point, maintain a healthy lifestyle awareness program. Let friends and family gap you can fill and family help you. Review your goal priorities. Keep line the communication open. Maintain honest and one-way or two-way communication with your loved one, doctors, others, your cancer diagnosis. Eat healthy diets, protect your sunlight because of the skin cancer, most affect the sunlight. Informations, preventions, avoid risky behavior to the cancer patients or individuals, get regular care to the cancer patients. What to expect to on the World Cancer Day 2022? The cancer community will make its voice heard on a global scale, generate the actions, raise awareness about the needs to close the gap in cancer care. फर्स्टली अवेयरनेस प्रोग्राम होने चाहिए हमारे लिए जो कैंसर के रिगार्डिंग जो कम्युनिटी को हम गैप को जब आप फिल कर सकते हैं the gap of in the cancer care and make sure that everyone has equitably access to life saving services to get World Cancer Day and close the care gap trending on the social media. A full day of live content streams on the World Cancer Day as well as on the World Cancer Day Facebook and YouTube channel offering a rare look at the work of the cancer's community. The cancer community will make a voice heard global, generate enthusiasm and actions and awareness program as well as the World Cancer Day help to guidance and counseling to avoid cancer patients or individuals and cancer patients discussions with expert and people living with cancers taking and the depth local area socio-economic status and look at the such as culture contents genders norms income and educational level as well as prejudice discrimination and assumption based on the age, gender, ethnicity, disability, lifestyles to create wide parties in cancer prevention and incidence and survival to the cancer patients or individual to the community. First, get regular care, avoid risky behavior, information to the cancers and awareness program. It helps to the prevention of the cancer. Thank you.
Thank you so much, Mr. Amir Khan, for your nice view on how to reduce the gap in community area regarding this care for the patient, for the oncology patient. Thank you so much for your views. Thank you so much, sir.
Thank you, sir.
We are in the stage, or we can see we are in the situation, current situation is on COVID. So, do you think that how this COVID during this stage, how this care has been served to the patient of oncology? It is not. It is not much easy to serve the people with oncology during this COVID scenario time. So here comes Assistant Lecturer Mr. Suraj is going to speak about the impact of the COVID-19 on cancer services, that how it was. So welcome Mr. Suraj. It's time for you to say about how this COVID-19 impacted on the cancer services. Yeah, Mr. Suraj, you can unmute and you can speak it out. Unmute, unmute.
Thank
Yeah.
you. I am very happy to participate in panel discussion. Now, I am going to talk about impact of the COVID-19 pandemic on cancer services. The necessary measure to contain the COVID-19 pandemic caused significant disruptions to cancer services, which will have an impact on health and cancer outcomes in the future. At the same time, cancer organizations and individuals around the world adapted and innovated to continue to deliver services and maintain the progress being made in cancer care. In many countries, during the early month of the pandemic, but also in subsequent waves, prevention and outreach program were suspended. Treatment were delayed or care cancelled. People living with cancer and their families faced enormous challenges to travel and visit care centers. Telemedicine and new developments in therapies and treatment protocols, as well as innovative ways to deliver support and conduct outreach, allowed many organizations to continue their work despite these disruptions. However, the health community anticipates a significant rise in late stage diagnosis and mortality in the month and years to come. Innovations and adaptations in response to COVID 19. Organization and healthcare workers are relying across the globe to support patients, resume screenings and diagnostics, maintain awareness on the need for prevention, and provide a safe environment for treatment. Volunteers have mobilized to deliver medication and even food to patients in need. For ensure treatment to care centers, the private sector is developing innovative technologies to reduce the time spent in care setting while maintaining quality to treatment. Digital technology is allowing doctor and research centers to collaborate and share knowledge at a global level and accelerating the move towards greater patient centered care. Disruptions to center care. Cancer organizations around the world struggle to maintain delivery of their life-saving services as a result of pandemic, not only due to drop in resources but also because of necessary measures enacted to contain the spread of the coronavirus and fears of contagious on the part of patients. Reports highlights short stage in frontline staff, sometime redirected to the COVID-19 response. Interruptions and delays in prevention programs, diagnostic and testing, clinical trials and research, difficulties in engaging in community outreach with restriction on level on travel and social gathering and gather barrier to accessing essential medicine in low and middle income countries. Now, universal health coverage. So, what is universal health coverage? Universal health coverage means that all people can benefit from quality health services where and when they need them without suffering financial hardship. It has three key dimensions. First is access to health services, financial risk protection, quality of services. So, access to health services. Everyone who needs services should get them, not only those who can pay for them. Financial risk protection. Those people should not fall into debt paying for treatment and care. Now, why is universal health coverage is important? At least half of the world population still lack full coverage with essential health services. At least half of the world's population, 7.3 billion people, still do not have access to the full range of essential health services. Over 800 million people, almost 12% of the world's population, use at least 10% of their household budget for out of pocket health expenditures. Almost 180 billion people spend a quarter or more of their household budget on health. This population is increasing at a rate of almost 5% per year, with women among those worst affected. WHO 2017. In a number of countries, the cost of cancer treatment and care, including cancer drugs, has pushed many cancer patients and their families to near bankruptcy. A study from India, for example, found that the odds of incurring hospitalization expenditures were nearly 160% higher for a patient with cancer than the odds of incurring catastrophic spending when hospitalization was due to a communicable condition. Thank you, sir.
Thank you so much, Mr. Suraj Kumar, for your views on the impact of COVID-19 on cancer services. You have shared many points about the health coverage and all the other thing. So, thank you so much for your views. Thank you so much.
Thank you, sir.
Okay, and next, how this can be closed. Next, how this uh, care gap can be closed through the networking. So, in order to speak regarding that, I invite Mr. Amit Kumar to speak about close the care gap through networking. Mr. Amit Kumar, are you there? Mr. Amit? Okay, in order to speak about the nurses' responsibilities during this for the cancer patients, how we can give care to the patients. So I welcome assistant lecturer, Mr. Uh, Lakshmikant, to speak about the nursing responsibilities
Thank you,
for the
sir.
cancer patient. Yes, Mr. Yes, Lakshmikant, you can speak it out.
Thank you, sir, for giving chance for speaking regarding nursing responsibility for cancer patient. Prior to chemotherapy administration, review the chemotherapy drugs prescription, which should have name of anti-neoplastic agent, dose, route administration, date and time that each agent to be administered accurately, identify the client medication to be administered in conjunction with the chemotherapy, antiemetic, sedative, etc. Chemotherapy is used to chemicals to treat disease for each considered to be father of chemotherapy. There are five phases: adjuvant therapy, conjunction with another treatment, neoadjuvant chemotherapy to shrink the tumors, prior surgical removal, primary therapy, localized cancer with therapies, alternative but less than complementary effective treatment, induction chemotherapy, primary treatment which no alternative therapy, combination therapy, two or more chemotherapeutic agent, allowing each medication to enhance the action to others. Aseptic technique is compulsory during provide nursing responsibility, disposable surgical gloves, use new gloves, mask, or follow the aseptic technique, protective eyes goggles to minimize exposure, wash hand before and after drug administration. Drug administration oral emphasize the importance of compliance the patient with prescribed scheduled drug with hepatic potential should be total with meals and subcutaneous to be administration IM or subcutaneous are few numbers. The subcutaneous use the smallest gauge needles possible for viscosity of the medication. Intravenous common method may be given through central venous catheter. Peripheral assist absorption is more reliable route required for administration of vein, and it also reduces the needle of repeating injection can be cost provide direct assist to the circulatory system. The potential for injection or treating therapies is a serious complication of chemotherapy. Nurse following guideline to be kept in mind. Distraction, solution container, and tubing. The sign contamination, including particles, cracks, or tears in bottles. Aseptic technique should be follow. Prepare according to manufacturer direction. Selected suitable vein, large vein of the forearm, the peripheral side. Use distal vein first and choose vein above area flexion for the viscount drugs. Use the distal vein of the metacarpal vein, then vein of the forearm. Preparation of extraordinary nursing responsibilities for the prevention of basation knowledge of drugs with vesicles, potential skill in drugs administration, identify the risk of factors, example multiple vein puncture, anticipation of the extraction, and knowledge of and Bowman protocols, new vein puncture site, daily prescribes assess administration of drug in a quick environment, provide a quick drugs dilation, observation, assess, and after basic drugs infusion, educating patient regarding symptoms of drug infection, pain, burning, etc. To conclude, it can be said that regarding nursing responsibility of cancer patient, all patients suffers from any type of cancer should have an extra attention. The nurse should be knowledge about different type of treatment so he can provide optimal care. Thank you.
Thank you, Mr. Lakshmikant, for your nice views on nursing responsibilities in the care of patient with cancer. Thank you so much.
Thank you, sir.
Next, to speak about the close the gap, care gap through the networking. Here comes Mr. Amit Kumar, Astral Lecturer. Yes, Mr. Amit Kumar, you can speak on the networking, how to reduce the care gap.
So, very good afternoon to all, and very thankful. I'm very thankful to all because my department has given me a chance to be a part of panel discussion. So today, actually, we are talking on particular topic that is cancer, how to fill a gap of the cancer. So, networking. What we are thinking about networking? Actually, networking it is an act of making contact and exchanging information with others, that is the people, groups, and institutions, and to develop a mutual beneficial relationship and sharing information between computers. That is the information networking. Nowadays, the people They are on network, internet they are using, and the benefit of a networking we will be get regarding kind of diagnosis, that is a cancer also. In networking we have many platforms like virtual live programs, workshop, seminar, webinars, and telephonic. Lot of are there. So networking is also have a important role nowadays because easily connect pupils, because in these platforms there are lot of expert in even experts have a lot of research already done in our community, even done in worldwide. So that report can be expressed, that can be spread to human beings in group, in institution and individual person. So network has an important role. If we are having a mobile, at that mobile, in that we can use YouTube and Google. Through that we can approach a particular website, even maybe any kind of, as we are in platform panel discussion, it is also a part of network. Through that we can expressing our views separately particular topics. So if other person can join, so they can also know the different people views, expert views regarding the topic. So that platform also networking platform also always there are the many experts, and they discuss with the people in live. So there is a report. Actually the point is, 2 points are there. So the people what they want, actually the people want, that is uh, the important points regarding how a filling a gap. Even before a filling a gap, they want to know the prevention regarding the cancer. So basically we want they want, even through the network we can give a specific points towards them. See, if anyone have a risk, so how they can save their self to the risk, that is screening test. So they can screen, they can get a screening test to identify kind of uh, cancer is there. So nowadays the vaccination shot also there, and healthy choice. And healthy choice, that means you can reduce your risk of getting cancer by making healthy choice like healthy weight, avoid tobacco, limiting amount of alcohol you can drink, protecting your skin. The point is there. So as I am saying, the healthy choice, I am spreading the point towards the people through that network. If a pupil is far away from me, how can I spread, how I can express my views, I can give my views towards that person. So nowadays the network has a uh, good way to express, and through that network we can fill a gap. I have a one point is there for filling the gap. That service is started in Thailand. So in Thailand, there is a two-thirds of patients are diagnosed regarding the breast cancer. So for that purpose, they organized, they started Sonda Breast Cancer Network. At that network, they are using to treat the people. Even they can express their views, they can uh, train the pupils, they can identify the cancer, even how they can make themselves to away, they can preventive measures, how they can know. So through that point, through that channel, through that network that started in Thailand, that hospital, Maharaj Nakron Cheng Me hospital, that hospital, they serve the training and education on the particular breast cancer through that network. So in that study also we can know ki, the thing is also there. So the network, the conclusion is the network is also have a good opportunity to spread what we know, should know the all people. That only we can close a gap. Thank you.
Thank you, Mr. Amit, for your nice presentation on how to close the care gap through the networking, and you just enlightened the various examples that how they found out the breast cancer, and through networking how they were able to uh, diagnose it and to control the cancer. So thank you so much, sir, for your nice presentation. And before I conclude, I would like to have the other panelists also. So we have come to an end of this panel discussion on the theme disclose the care gap. So whatever we discussed, let's take as a lesson, and we can have this in our life, in our professional life, to close the care gap for the cancer patient, that rebuilds the patient's confident, and they have the ability to live, or they have the ability to come over all their difficulties. So on this auspicious day, I thank each and everyone those who have viewing through this live show, and I thank all the panelists for your time that you have spent towards this, and all the best for the next time. Thank you so much.
Thank you. Thank you so much.